If you want to imagine going to the grocery store, paying top dollar for the best surf and turf meats, the freshest vegetables, some beautiful potatoes, then spending hours preparing it in pots and pans, slaving over the oven and the stove cooking it to be just perfect. Now, finally, put together the beautiful plate of food for you and your family or spouse for your anniversary. Everything's perfect until you stumble on the way to the table and you drop it everywhere all over the floor. Now, I'll tell you how you're probably doing the same thing every day in your dental practice. Stay tuned. Welcome to day 2 of our look at how to improve your dental practice's phone training. Now, this is probably the biggest thing that I see a dentist sabotaging their own practice and their own marketing efforts with keeping them from getting new patients. Now, yesterday, I told you how you can spend tens of thousands of dollars on all of your marketing, have it all working perfectly, but still not end up with enough new patients because you lose them at the phone call. Now, I gave you 5 tips yesterday on how to improve this. Just to recap, they were: open strong, use the caller's name, control the conversation, find the problem, and restate the problem. Now, before we move on to the next 5 tips for today, today's first tip I want to talk about is something that really should happen from the beginning to the end of the call. At number 6, always make sure that the tone of your voice is right. If you are disinterested, the patients are going to know it. The patients are going to think that you don't care. If the caller has said that she is in incredible pain, you should not sound like this is the happiest day of your life. You should empathize. This is where the word appropriate comes in. You've got to sound sincere and compassionate to close that patient. 7th, set the appointment. This is the point of every call. This is the goal. Every answer to every patient question should be directly or indirectly to come in and see the doctor. We can help you more once we can see what's going on. Next, get contact information. This is true whether they make an appointment or not. Some techniques have you do this as soon as you get the person's name. That would be something like, "To who am I speaking? Okay, Mary, thanks for calling us. Can I get a phone number just in case we get disconnected? Thanks. Now, tell me how Dr. X can help you." 9th, after you have set the appointment, ask how the caller heard about your practice. I'll tell you, I get more skeptical of this one every year. I've told you before how you just can't trust dental patients to really remember where they actually heard about you. All of your marketing should be tied to tracking phone numbers like what we do for our clients, but it never hurts to ask, even if you've just started something new. Finally, close the call with a reminder of how your office is going to solve their problem. Make sure to restate the caller's name again. This will reduce the number of no-shows and cancellations. Follow these 10 tips. You'll see your marketing become exponentially more effective day over day. As always, keep moving forward.